Hello, everyone. I'm sorry I'm not able to be with you in person today, but since healthcare reform is so critical and still so intense in Washington, I am pleased to have the chance to discuss it with you from miles away. Before I get started, I'd like to congratulate NATCO President Lori Coleman on a great year. I also wish President-elect Bill Haskamp and the entire organization the best of luck in the coming year. In 2009 and 2010, our country went through a profoundly significant debate on the future of healthcare reform in this country. I don't have to tell any of you that fact because many of you participated in it and watched it very closely. But I want to just say at the outset that the presence of NATCO on Capitol Hill, folks who were so directly involved in the issue of transplants, both from a provider standpoint and a family and patient standpoint, in my opinion, had a huge impact on the debate and on the course of legislation through Congress. You know, we have a lot of consultants and pollsters who talk to us all the time down here about public opinion and just the back and forth of how the debate process works. One thing that I am totally convinced of, having gone through this process over the last couple of years as a member of Congress, is that the personal experiences, the stories of patients and families who had to go through a system that, as many of you know, was broken in terms of the rating and exclusion of individuals with chronic health conditions and serious health conditions through the pre-existing condition processes in the insurance industry, that those personal stories, which NATCO shared with members of Congress over and over again, in my opinion, had a profound impact on the outcome of the debate. So congratulations to all of you and the great work that you did. There's been a lot of talk about the bill, but from my perspective and what I have heard already, nothing is more important in this bill than the elimination of pre-existing conditions. This change, which was desperately needed in our coverage system, and Americans are already seeing this benefit. Addressing this crowd about pre-existing conditions protection is especially significant, as I said, because NATCO was such an early supporter of abolishing this practice. As practitioners that deal with these exclusions with your patients, you understood the desperate need for reform, and I want to thank you again for your early advocacy. Pre-existing conditions affect millions of Americans. In the insurance actuary world, pre-existing conditions are defined broadly, expanding the pool of affected Americans exponentially. These conditions range from something as natural as pregnancy to something as life-threatening and complicated as a heart transplant. As we get older, and I'm getting there, the number of ailments accumulate, and consequently, the greatest burden of pre-existing condition exclusions hits older Americans, the pre-Medicare eligible demographic, that age 55 to 65. Because the scope of pre-existing conditions is so broad, millions of Americans are left without coverage. This is especially problematic for those who try to purchase coverage in the individual and small group market. As a former small employer, I directly experienced that frustration. Small businesses and the self-employed, those are the ones that get hit the hardest. For those with employer-sponsored coverage, pre-existing condition exclusions aren't as common. However, the safety net of employer-sponsored coverage has been eroded as the number of unemployed Americans grew in 2008 and 2009. Bottom line, the status quo left millions without coverage and millions susceptible to losing coverage based on pre-existing conditions. Furthermore, the system of denying coverage based on internal biology is, in my opinion, as fundamentally unfair as the old Jim Crow laws that discriminated against people because of the color of their skin. These are conditions which none of us have control over. But thanks to healthcare reform, that type of discrimination because of people's internal conditions, whether it's a diabetes or a cancer or high blood pressure, will now be a thing of the past. Since being elected to Congress in 2006, I have worked with NATCO introducing legislation to both scale back and completely eliminate pre-existing condition exclusions. Again, NATCO was such a great early supporter of both bills and maintained support for the protections throughout the reform debate. As a result of the new law, even in 2010, insurance protections for children with pre-existing conditions will be in place as early as this year. For plans years beginning after September 23rd, insurance providers will no longer be able to deny coverage to children based on a pre-existing condition. So an epilepsy, a diabetes, conditions that affect children even at the earliest ages will no longer harm and punish those patients and their families. Secretary Sebelius has made clear to the insurance industry that any attempt to skirt or eliminate these protections will not be tolerated. For those who have been without coverage due to pre-existing condition exclusions, the new law also creates a temporary pre-existing insurance pool with a mechanism in place that creates subsidized premiums so that individuals will be able to afford coverage even if they do have some chronic condition. This new program has already gone into operation across the country and has already started to accept coverage applications. In Connecticut, where I come from, Governor Jody Rell, Republican Governor Jody Rell, announced the implementation of this program, which will go into effect August 1st. And the Department of HHS has information on this and other coverage options now available through a new comprehensive online tool. Of course, this is only a start. Beginning in 2014, when the bulk of the reforms will be implemented, pre-existing condition exclusions will be a thing of the past for everyone. While the benefits of the new law are already being felt, the protections in the new law cannot and should not be taken for granted. In fact, many of my colleagues in Congress are running on a platform and proposing a platform of repealing the law. Again, NACO's voice throughout the healthcare reform was critical to its passage. Your voice, which carried us across the finish line, is going to be critical to making sure we don't go backwards as a nation. Your voice convinced people that change was needed. Your voice is telling Americans that change was right, but don't rest your voice yet. Do not take for granted how far we have come, because the voices calling for repeal are nipping at our heels. Keep fighting, keep helping, keep saving, keep making a difference. Again, to all of you from NATCO, thank you for your great work, and I look forward to working with you in the future. Thank you all.